Hi, everyone, and welcome back to the hashtag See Arthritis event at this year's Canadian Rheumatology Association and Arthritis Health Professions Association annual meeting. We are so happy to be here today with Michelle Bridge. Welcome to the studio, Michelle. I know you're a first timer at the hashtag See Arthritis event, and we're really happy to have you here with us.
Thanks, Cheryl. And
Yeah.
thank you for all the work that you do at ACE too. I
Oh,
mean, you're such a powerful and admired patient advocate. So thank you.
well, we're happy to bring the things that are floating in your brain out to our audience, which is across the country. So thanks for spending time with us. I'm going to let the audience know a little bit about you, Michelle. Michelle is the new president of the Arthritis Health Professions Association, the partner, one half of the partnership that brings this annual meeting together, which is really the time where people in rheumatology come together to share their knowledge, to share their practice experience, and all points in between. So it's really a terrific meeting. Michelle is an advanced clinician practitioner in arthritis care, or as we lovingly call you, ACPAC, trained occupational therapist. And that's with the Arthritis Society of Canada's Arthritis Rehabilitation and Education Programming. And that covers the Windsor-Essex County in Ontario. You're the association's liaison for the ACPAC Special Interest Group, and you have previously contributed as chair of the Education Subcommittee, as well as being the website liaison. So again, Michelle, welcome to the studio. Our audience knows a little bit more about you now, and we're going to just dive right into our conversation, if that's okay with you.
Sure.
Yeah. So first of all, Michelle, tell our audience, um, what's an occupational therapist? Not everyone, as we were chatting before the cameras started to roll, knows about occupational therapy in the setting of arthritis or rheumatology, and how important it is in the team. If you look at the team care aspect of a patient's life with arthritis. Tell us a bit about yourself, your qualifications, your training, and the role of occupational therapy in rheumatology.
Sure. So yeah, I am an advanced clinician practitioner in arthritis care. It's an extended role practitioner, but you do have to be like it's a postgraduate program. So you do have to be an occupational therapist or a physiotherapist, a nurse or chiropractor. Specifically relating to occupational therapy, we focus on occupations. Surprise, surprise. But what the trick is many people don't realize what exactly the definition of occupations is. So we believe occupations is every little task that you do throughout the day. You know, it's your activities of daily living, it's your instrumental activities that you do throughout the day. And we really help with empowering our patients to be as functional as they can so that they can, have a better quality of life. If our patients are suffering from not being able to get in and out of their showers, we can help problem solve. We can assess the situation. We can, figure out, of course, let me backstep, figure out what our clients' goals are. So assess the situation, assess their physical, like do a physical exam, do an environmental exam, and then we can recommend the appropriate resources, the appropriate equipment to help facilitate that function. And again, like I said, so that they can remain more independent at home or wherever their living situation is.
Right. Yeah. So I think as a patient myself, we have to sort of remember that occupation doesn't just mean what you're paid for between the hours of, 9 to 5. Occupation is sort of task related, if you will.
Yep,
And you
exactly.
have an occupation in your home. For some, they may think, yeah, my job is tougher at home than at work. If you have a large family or, have people who have high needs around you as well as yourself. So thank you for that definition, Michelle. I kind of shortchanged you a bit. I know you've been the president of your association And it didn't just happen yesterday, that you've been doing yeoman's duty for a while now. And I guess this meeting happening or just finishing up in Winnipeg is sort of your rollover. So you now head into your next year of your term. As the president of the Arthritis Health Professions Association, Michelle, tell us sort of what you've learned over the last year about your association, the memberships. What some of your key accomplishments have been? This is your chance to toot the horn of the AHPA, and talk to us maybe a little bit about your goals for 2024, 2025. So we're just early into the year, but I'm sure you've already made tons of progress. But tell us what you're trying to do, not just within the AHPA, but I know access to ACPAC trained therapy. So this sort of notch up level of expertise that lives within your professional area.
Okay, so I'll kind of break it down a little bit for you. So
Yeah,
we're at AHPA, in terms of our president roles, we traditionally have three presidential positions. So president-elect, president, past president. So they're each 1 year terms for a total of a 3 year commitment. And each president carries forward one of our strategic pillars. And so those would be engagement, knowledge translation, and sustainability. So it's easiest for me to kind of break it down into those three
yeah,
buckets. So I'm in charge of or responsible for the engagement portfolio, and I will keep that portfolio within my 3 year term. And so this past year, we had a very productive year. It focused on enhancing communication with our members, strengthening partnerships with with different organizations. And so when it comes to our members, we really focused on maintaining transparency through email updates and news briefs, news flashes, really to keep our members informed about various education events, research opportunities, member involvement. One of my favorite is partner spotlights, just, providing valuable resources and a host of other pertinent updates. And the board really worked together, in addition to these emails, to launch our discussion forum. So this is empowering members to engage with each other. We also had a big focus on networking, because we heard from our members that this is one piece that they really wanted us to focus on. And also, we hosted a successful virtual education event on elevating lupus outcomes, which actually helped us to attract some new members as well. And then when it came to engaging our partners, again, this was last year was my first year into it. So I was kind of
right.
introductory. I was fortifying these connections with our professional and our patient organization partners. I even initiated some engagement with our research organizations. So it was all about kind of laying the groundwork, inviting our partners to various events, and really continuing with the follow-up through those activities. And then there's, you know, I was involved with you with the arthritis ecosystem, the champions table there. And so we're involved with developing a nationwide arthritis action plan. So, so that's kind of my role within engagement. But then our next big pillar is sustainability. So this is Samantha Holmgren's pillar at this time. So she's currently our past president, and her big focus was developing our 5 year strategic plan last year. So now we're going to start to roll that out. Sustainability has been a major focus, particularly with regards to funding. And then also another barrier that we're experiencing is with member involvement on our board. So we're going to, identify and reduce some barriers there, increase membership numbers, improve the onboarding process, develop a strategy to attract talent to the board. And then the last big pillar there is knowledge translation. So last year, under the leadership of Paul Adam, the AHPA Education Committee organized and planned very successful education events. There was um, two online education sessions that were focused on arthroplasty related topics, and we had a major joint education event, and of course our biggest event, I would say, is our AHPA pre-course. And so now Paul has sadly finished his 3-year term, and we thank him tremendously for his significant impact. Um, and now we are on the search for a president-elect that will carry the knowledge translation portfolio. So the focus here is to refine, improve the research and knowledge dissemination that we've been doing. And of course, this is one of the primary benefits of AHPA membership. And so now that this position is vacant at the moment, you know, we're not going to totally ignore knowledge translation. It will be more of a shared portfolio until we find someone to, you know, step up to that position. But also we're going to we're going to change our strategy a little bit and perhaps recruit members to do little micro volunteer positions as opposed to one big board of director model.
Yeah.
And then when it comes to ACPAC, I mean, those big strategies really do fall within the scope of the special interest group. But you know, there continues to be a major interest in promoting our models of care, because all of our ACPAC, well, not all, but like we have multiple models of care that's shared between, you know, many of our ACPAC graduates. So our chair is Julie Harrington, and she's working hard they're finding themselves in the same predicament of it's hard to fill these board positions. So she's, you know, dedicated to trying to fill those board positions to amplify the work that was previously done in terms of the special interest group's 3 pillars, which are advocacy, research, and education. And so as you had mentioned, I was the previous education chair, and we don't have an incoming education chair yet. So she has changed her strategy a little bit in that she's invited special guests, such as yourself, to our ACPAC special interest group meetings. So she's going to do little micro education as opposed to traditionally our big major event that has been held alongside our annual general meeting. So yeah, that's pretty much.
It sounds like you guys have done lots of tinkering, retooling in order to be more effective, not just obviously within for your engagement between members, with and between members. But I think for our audience, Michelle, it's really important to understand that engagement that you're so focused on, that knowledge translation work that has been begun and grown, all of that makes more engaged members. And I'm going to argue for you that makes for better therapists. And better therapists means better service to me. Enhanced ways to engage with me as a patient, to improve, you know, the outcomes for me. And I think this is sometimes for the lay public, sometimes lost. Like you see medical associations or professional associations think, what are they doing? Well, all of the activity you've just described, and it's a ton, so congratulations on everything that you guys have done to, I think, make the operation of the HPA more, I don't want to just say more sophisticated, but more effective. Like clearly assigning these pillars, understanding who's championing those pillars, knowing that work is being done, the outreach work is being done in each of those pillars, is really critical to engaging your membership, who then turns around and engages with me. And so huge credit to everyone there doing really, it's hardcore volunteer work. And I heard you say several times you're now looking for. So shout out there to anyone who's a physical therapist, a nurse, an occupational therapist, people who are in this field and a member of the Arthritis Health Professions Association, maybe you want to spend some time with your colleagues and advance the mission and the vision and the goals in 2024, 2025, and beyond. So there's my plug for you, Michelle.
Thank you.
Little recruiting work.
Yeah.
So all of that to say, from our own membership, is quite large and is coast to coast and bilingual. Thank you very much for everything that you're doing to make your membership as strong as it can be, to make it as large as it can be. The more members you have, the more people who outface to my community who have specific training in my disease or in another person's disease. So I can't tell you how invaluable, well, you know this because I sing your praises all the time, but I want to do it here on the hashtag See Arthritis program and during this year's meeting because I think it's so important. So next question. The theme of the meeting this year is really centered around shared decision making. And I actually think arthritis health professionals, such as occupational therapists, physical therapists, nurses, social workers, I actually think that those people are kind of like the communication glue. I think you guys are such an essential part of that shared decision making, not discounting the role of the rheumatologist or, the medical assistant who works for that rheumatologist, but I actually spend more time with you often than I spend with my rheumatologist. I get to come in to see you repeatedly, hopefully, while I'm dealing with a specific problem or therapeutic course. So, with that in mind, Michelle, maybe tell us what you think and your colleagues think about shared decision making and the role of the professionals in your association. What role do you play in all of that?
Yeah, sure. So I think shared decision making is really the cornerstone of patient-centered care, and I'll even be biased and say, especially in arthritis management. To me, it means collaborating with patients to make informed decisions about their treatment plans based on their values, their preferences, and of course, the clinical evidence. So really, I strive to integrate shared decision making into every patient encounter. After obtaining informed consent, I would prioritize establishing that open communication with my patients. So I want to really ensure that they feel heard and understood. And, it's important that they express their goals, their concerns, their treatment preferences, and this dialogue really forms that foundation of shared decision making. And I would even argue it helps with building towards that therapeutic relationship and that trust, which is so critical.
Yeah.
So, providing comprehensive education about the rheumatic condition. So, this would include disease-specific information, self-management, and medical management, right? Like earlier you said, the specialist might be just focused on that medical management, but we're very comprehensive in our education, and then also to discuss about those potential risks and benefits.
Right.
And I really think, empowering patients with the knowledge, then they become active participants in that process. And I always tell my patients, you are the CEO of your own body. So it's really important that, you make that educated, informed decision through the assistance of, that shared process. So, offering decision aids like information pamphlets, videos, online resources will definitely help to supplement our discussions. Um, these tools really help patients better understand their options and the potential outcomes, so facilitating that decision making. And then, supporting patients in weighing the pros and cons of different treatment strategies based on like their individual circumstances, their values, their priorities. So together we really explore various approaches and collaboratively arrive at that like mutually agreed upon plan. And then lastly, I just wanted to say, ensuring that ongoing communication and follow up to reassess the treatment effectiveness, to address any concerns or changes in patient preferences. But really, and I think this is like my OT coming out, is really adapting that treatment plan accordingly. A patient has a goal or has something that they want to do, and they may not be able to do it. So I never say, well, then don't do it. I say, how can we change, the scenario to make you more successful of doing what you want to do?
Yeah. Yeah. I think that, I mean, that is the sea change in arthritis treatment and care from the time I was diagnosed almost 35 years ago, Michelle, to today. I used to hear the word in in the early course of my disease, and the key word was don't do that. And I'm a bit of a renegade. And I never really listened because it intuitively didn't feel right for me. Now, I did say that. I said, look, I'm not going to stop riding my mountain bike. I love it so much. I'm an outdoors person. What can what can you do to help me? And I actually was asking some of the questions 34 years ago that are bang on to your clinical approach today, which is, how can I help that person do what they want? But it's so much more important than just doing what you want, Michelle. And I know you know this, but just for our audience sake, it's more than doing what you want, it's being who you want to be. It's being who you want to be in the deepest part of yourself.
Yep.
And that connection is so strong for a lot of people who have had very energetic, sort of athletic lives, or just socially very active. We want to know, how can we stay ourselves?
Mm.
And that's what your profession does for us. And so we thank you really from the bottom of our hearts. And the other thing I was going to ask this question to wrap up our time together was about insights that you could share to improve a patient's, their disease course, really, and about sort of self-care. We prefer to call it self-care than self-management. Self-management sounds a bit administrative. Self-care, I think, is what we do every day. It, like, starting your day and thinking about what cup of tea you want to have, to me, is self-care. It's every little thing I do in my day that makes my day Cheryl's day, not rheumatoid arthritis's day. And so from your perspective, give us just quickly one or two little pearls about how someone can improve their self-care, self-advocacy journey. And we now know those two things are inextricably linked.
Yeah. So like I said, I want to empower my patients
Yeah.
to be the CEO of their own health. We talked about the education, the awareness, the shared decision making, goal setting, action planning is really important. But yeah, that self-care, those skills are very important. We want to equip our patients with strategies to better cope with their signs and symptoms, to improve their quality of life. So this might be pain management strategies, stress reduction, of course, exercise, just various healthy lifestyle habits.
Yeah.
We want to be able to, encourage our patients to connect with various like support networks, different online communities, peer networks where they can share their experience and seek advice and find emotional support. And then that advocacy piece, like you said, it's important to empower patients to advocate for themselves, within the healthcare system, but also, at work. or at school
At
or
home, at
whatever at
home.
home, yeah,
Yeah.
with their family, like whatever environment they're in. So this may involve teaching them how to communicate effectively with, the people who they're surrounded by. And then, like I said earlier, the regular follow-up and monitoring, I think, excuse me, I think is really essential for maintaining patient engagement and adherence to their treatment.
Yeah. Yeah, I want to thank you, Michelle, for everything you're doing. I just CEO of your care. We often use the word quarterback, team captain, CEO. Choose your label for leader, and that's what you should really try to feel in your heart as you live your day with this disease. And we're so thankful that the Arthritis Health Professions Association is out there to help us do that. We're so grateful for our partnership at Arthritis Consumer Experts with the Arthritis Health Professions Association, and we look forward to just getting down into the weeds with you, so to speak, to further your mission to ensure that there's just fantastic care out there for people living with arthritis. So thank you very much for coming in. Here, I'll give you my
Yes,
powerful heart symbol. There you go.
I
Uh,
love it.
and we wish you a great rest of week. And thank you again for joining us. For those in our audience, you're going to find a slide following this thank you, and it will offer a pile of resources that you can check out on this topic. Thanks again, Michelle, and have a great day.
Thank you for the opportunity. Take care.
Yeah.